Good day, everyone. My name is Janice Amil, and I'm your student midwifery. And today, I will be performing the perineal flushing. So, perineal flushing or perineal care is involves the washing of the genitals and rectal area. This procedure done is in order for us to prevent the irritations, odor, and the infection of the genitals area. And now before we start, we need to prepare our patient. First, we need to explain to our patient with what we will gonna do so that our patient will not shock if we touch their body, especially to their genitals area. And then we will provide privacy by screen and drape the patient as for the vaginal examination. And we will remove all the articles that may interfere with the procedure. For example, the erection and so on. We will give an extra pillow to raise the head part of our patient. This procedure will also give our patient a comfortable position during the procedure. And then we will roll the draw sheet to the opposite side to prevent soiling when the bedpan is placed under the buttocks. Over draw sheet, and then we will offer the bedpan, and then we will keep the bedpan clean and on the bedside on your working side. And then we will untie the pad if any, and we will observe the discharge, this its color, odor, and amount, and so on. And we will leave the patient for some time so that she may pass urine or stool if it's necessary. And we will get the toilet tray and arrange the articles conveniently on the bedside of our patient's bed. And then now we will proceed to arrange all the necessary equipment. And now we will proceed to our necessary equipment. So we will have the pitcher filled of lukewarm water, two kinds of forceps, a kidney basin, cotton balls. I have 14 cotton balls. The the dry cotton balls, and the other seven cotton balls soaked with the antiseptic solution. And then the cranial pad, the surgical gloves, and this is the draw sheet, and this is will be assuming uh, bedpan. And like other procedure, first we need to wash our hands. Since I already washed my hands, I will just sanitize my hands using the alcohol. You can also use the sanitizer or sanitizing rub. I already washed my hands and I already sanitized my hands also. I already donning my gloves. So before we go to our procedure, I will establish rapport with my patient, and I will ask her name and how she may feel. Good day, ma'am. My name is Janice Amin, and today I will be performing I will be do the perineal flushing. So I will be touching some of uh, your body, and especially with your perineal area. Is that okay with you?
Yes.
Okay. This perineal flushing procedure done to prevent the irritations, odor, and also the infection that may spread on your perineal area. Okay. What's your name, ma'am?
Finally.
And then I will give a privacy for my patient. I will close the curtain so to give privacy for my patient. And then I will drape this bed blanket. This to prevent the exposure to our patient, and also give warmth to our patient. And now I will be position my patient in a dorsal reclined bed so that it will be easy for me to do the procedure. Ma'am, I will put your feet in a horizontal. Now I will place the draw sheet. So it would be to prevent the bedpan soiling to the bed. And now, since I already put the bedpan and the draw sheet, I will make sure that I will minimal exposure for our patient so that it will be lessen the embarrassment of our patient.
Oh, wait.
Okay, since I already put the bedpan over the bedpan and the draw sheet, I will make sure the minimal exposure of my patients. This is to prevent the embarrassment and to the lesser embarrassment for our patient. And then I will pour the warm water to the perineal area of my patient. These to wash off and discharge the perineal. And then clean the perineum using wet swab. The reason why we're using the wet swab is to prevent the entrance of bacteria from the colon into the urinary tract. And then hold the swab with forceps and clean from above. Clean from above and use one swab per swabbing. So first we need to clean the perineum in the midline outwards of the following order. So first we need to clean from the vulva down to the anus and discharge. Second, the labia, then discharge. Just do likewise. And then inside the labia, discharge likewise. Discharge. Then the outside of the labia. Then discharge. And then clean the perineal region and anus thoroughly. And then we remove the bedpan from the by supporting the hip of our patient as before, and then we turn and now we will turn the patient to the other side and to dry the buttocks with the dry rag. So I will be using the cotton balls to dry the perineal area of my patient. Same as the procedure when we wet the perineal area of my patients. So we're starting from the vulva. The labia. Likewise, same as the other side. outside. Okay, and then after we done the procedure, if we need to apply, if we see that the patient needs to apply the medicine, we will apply the medicine, and the pad or the perineal pad if it's necessary. And then remove the draw sheet if it extra is used. And then we will change the linens if it's necessary, and then we will straight the bed clothes and arrange the bed linings. And then make sure that the patient feel comfortable after the procedure. And then we will get the we will take the bed pad to the sanitary annex, remove the cotton swab, and empty the content into toilet. And then we will clean the articles, to boil the forceps, replace all the articles, remove the screen, and tie up the unit. And then we will wash hands after the procedure. Okay. Since we already have done the procedure, I already tied the unit and also bring the bedpan to the sanitary annex. And I already been washed my hands after the procedure, same as the other procedure. We need to wash our hands before and after the procedure. And after this procedure, the perineal washing or perineal flushing, we will record the procedure and with date and observe that if any discomfort from our patient. And that's all. Thank you.